Hi, my name is Catherine Miller, and I'm a regional manager for the Office of Child Care within the Early Learning Division of the Oregon Department of Education. So on August 14th, we issued new guidance for operating childcare and other early learning programs during COVID times. We're doing a series of videos to help you understand and implement the new guidance. So please start by watching the introduction video from ELD Director Miriam Coldreau. The introduction video describes the purposes of the guidance and the process we use to develop it. Then watch the overview video. The overview video describes who the guidance applies to and the process you need to follow to legally operate. One of the examples you'll see in that is that we continue to operate under the Emergency Child Care or ECC system, which requires licensed child care providers and others to apply and be approved to operate as an ECC. So this particular video covers hand washing and general hygiene. So this is going to be section 8 of the new guidance, and you'll find it on page 39. The point of this section is reducing the spread of COVID by focusing on keeping hands clean. It's a very short but important section, so you'll want to pay close attention to it and reinforce it often with kids and staff since it is so critical. Some of this information is going to overlap with other sections like pick up and drop off, and we've got a video on that, so you'll just want to make sure to watch that one for details as well. So here's an overview of this section, and so things you'll want to make sure hand washing materials are easily accessible for each stable group. You're going to want to require children and staff to wash hands for at least 20 seconds before and after eating, preparing a bottle or food, feeding a child, before and after giving medication, after you use the toilet, when you help a child with the toilet, before and after diapering, after wiping a nose, coughing or sneezing, yours or anybody else you help, when coming in from outdoors, when entering or leaving the child care facility, when staff move between stable groups, and after they are sharing toys or other materials. You can use hand sanitizer instead of washing hands, but only for some of the activities I had just listed. So for anything that involves food, administering medication, toilets, diapering, those types of things require hand washing, and you can't use sanitizer as a substitute. If you do choose to use hand sanitizer for your facility, the hand sanitizer has to have an alcohol content of between 60 and 95%. And remember that those hand sanitizer bottles have to be stored out of reach of children when they're not in use. So remember, part of the drop-off procedure also is to have a way for anybody entering the child care to wash their hands or use hand sanitizer. So either outside the building or immediately inside. If you have questions about this section, you're going to want to email them to our email address, which is providercontact@state.or.us. We also have a frequently asked questions section on our website, and we're going to be continually updating that with your questions and our answers. So we really just wanted to say thank you for watching, and thank you just so much for providing nurturing care and education to children and this crucial resource for Oregon's working families. Thanks.